Hello everyone, and welcome to this lecture on enzyme inhibitors. I'm Muhammad Shahid Nadeem, and I'm excited to guide you through this important topic. We'll be exploring the different types of enzyme inhibitors and their applications. Let's dive in. Feel free to reach out with any questions. So what exactly are enzyme inhibitors? Simply put, they're molecules that interfere with enzyme catalysis. They can slow down or even completely halt enzymatic reactions. This process is known as enzyme inhibition, and we'll be looking at two main categories, reversible and irreversible inhibitors. This flowchart provides a clear overview of the classification of enzyme inhibitors. As we mentioned, we have reversible and irreversible inhibitors. Reversible inhibitors are further divided into competitive, non-competitive, and uncompetitive types. Irreversible inhibitors include reactive substrate analogues, group-specific inhibitors, and suicidal inhibitors. Let's start with reversible enzyme inhibition. These inhibitors bind loosely to the enzyme and dissociate rapidly. We'll focus on competitive inhibition first. In this type, the inhibitor competes with the substrate for the active site, often because its structure closely resembles that of the substrate. This diagram illustrates the competition between the substrate and the inhibitor for the enzyme's active site. Notice how both the substrate and the inhibitor are vying for the same binding location. The degree of inhibition depends on the relative concentrations of each. An important point to remember is that with competitive inhibition, increasing the substrate concentration can decrease the level of inhibition, assuming the inhibitor concentration remains constant. The enzyme can bind to either the substrate or the inhibitor, forming either an ES or EI complex, but not an ESI complex. In competitive inhibition, a high substrate concentration reduces the likelihood of the inhibitor binding to the enzyme, while the maximum reaction velocity, or Vmax, remains unchanged. The Michaelis constant Km, which represents the substrate concentration at half Vmax, will increase. This graph visually represents the effect of a competitive inhibitor on enzyme kinetics. Notice that both curves reach the same Vmax, but the curve representing the reaction with the inhibitor present requires a higher substrate concentration to reach that maximum velocity. This is reflected in the increased Km value. Here, we introduce the alpha factor, which is a function of inhibitor concentration and affinity. It's always greater than or equal to 1. Kmap is the apparent Kmm measured in the presence of the inhibitor. The inhibitor makes the substrate concentration appear lower and the Km appear larger. This is a Lineweaver-Burke plot, a useful tool for visualizing enzyme kinetics. The plot shows the reciprocal of the reaction rate against the reciprocal of the substrate concentration. The different lines represent varying levels of inhibitor concentration, with the slope increasing as the inhibitor concentration rises. Let's look at a real-world example: allopurinol, a drug used to treat gout. Allopurinol is a competitive inhibitor of xanthine oxidase, an enzyme involved in the production of uric acid. By inhibiting this enzyme, allopurinol reduces uric acid formation, alleviating the symptoms of gout. Another important example is statins, commonly prescribed cholesterol-lowering drugs. Statins are competitive inhibitors of HMG-CoA reductase, a key enzyme in cholesterol synthesis. They can significantly lower blood cholesterol levels and reduce the risk of heart attack and stroke. This slide further explains how statins work. By inhibiting HMG-CoA reductase, statins block the conversion of HMG-CoA to mevalonate, the rate-limiting step in cholesterol synthesis. The structural similarity between statins and HMG-CoA allows them to effectively compete for the enzyme's active site. This table summarizes several clinically useful competitive inhibitors, their target enzymes, and their therapeutic uses. You can see how these inhibitors play a crucial role in treating a variety of conditions, from high cholesterol to cancer. Now let's move on to mixed or non-competitive inhibition. Unlike competitive inhibition, this type doesn't involve direct competition for the active site. The inhibitor binds to a different site on the enzyme, known as an allosteric site, and can bind whether or not the substrate is already bound. Non-competitive inhibition can be either reversible or irreversible. If the inhibitor can be removed without affecting the enzyme's activity, it's reversible. If removing the inhibitor results in a loss of enzymatic activity, it's irreversible. The kinetic properties are the same in both cases. In non-competitive inhibition, the Vmax is lowered, but the Km remains constant. The inhibitor effectively reduces the concentration of active enzyme, leading to a decrease in Vmax. Because the inhibitor doesn't interfere with substrate binding, there's little effect on Km. Heavy metal ions such as silver, mercury, and lead are examples of non-competitive inhibitors. They often inhibit enzymes with sulfhydryl groups in their active sites. Bl, or dimercaprol, is an antidote for heavy metal poisoning as it binds to these ions and removes them from the body. Lewisite, an organoarsenic compound, is another example of a substance that can be treated with dimercaprol. Lewisite acts as a vesicant, causing blistering and lung irritation. Dimercaprol is used to treat acute poisoning by arsenic, mercury, and lead. Next, we have uncompetitive inhibitors. These inhibitors bind only to the enzyme substrate complex, not to the free enzyme. This binding distorts the active site, rendering the enzyme catalytically inactive. Increasing the substrate concentration will not decrease the inhibition. These graphs illustrate the effects of an uncompetitive inhibitor. Notice that both Vmax and Km are lowered in the presence of the inhibitor. The Lineweaver-Burke plot shows parallel lines, indicating that the inhibitor affects both Vmax and Km equally. Uncompetitive inhibition is relatively rare. Examples include the inhibition of lactate dehydrogenase by oxalate and the inhibition of alkaline phosphatase by L-phenylalanine. Now let's discuss irreversible inhibition. These inhibitors bind to the enzyme very tightly, usually through covalent bonds. The enzyme does not regain activity when the EI complex is diluted, and the complex dissociates very slowly. Organophosphate poisons are a prime example. Group-specific inhibitors are a type of irreversible inhibitor that covalently binds to specific side chains of amino acids in the active site. D-isopropyl fluorophosphate, or DIFP, is a nerve gas that terminates the activity of acetylcholinesterase and inactivates many serine proteases. DIFP binds to the active serine site of acetylcholinesterase, inhibiting its activity. This leads to an accumulation of acetylcholine, causing overstimulation of the autonomous nervous system. The bond formed is irreversible, and activity can only be regained if new enzyme is formed. Cyanide and hydrogen sulfide are other examples of irreversible inhibitors. They strongly inhibit the action of iron-containing enzymes like catalase, peroxidase, and cytochrome C oxidase. Reactive substrate analogues, also known as affinity labels, are molecules structurally similar to real substrates. They contain reactive groups that modify the side chain of an amino acid irreversibly in the enzyme active site. Bromoacetol phosphate is an example of an affinity analog. It inhibits phosphotriose isomerase in glycolysis by modifying a specific glutamate residue in the active site. Another example is the interaction between chymotrypsin and TPCK, a protease inhibitor. TPCK interacts with his 57 at the active site of chymotrypsin, irreversibly inhibiting the enzyme. Finally, let's discuss suicidal inhibitors, also known as mechanism-based inhibitors. These inhibitors bind to the enzyme as a substrate analog, undergo a normal reaction, become reactive, and then bind irreversibly to the enzyme's active site. Aspirin is a well-known example of a suicidal inhibitor. It inhibits cyclooxygenase, an enzyme involved in the production of prostaglandins, which are involved in pain, fever, and inflammation. Prostaglandins are produced from arachidonate by prostaglandin H2 synthase, also known as COX. This enzyme has two catalytic activities, a cyclooxygenase and a peroxidase. Aspirin inhibits cyclooxygenase by acetylating a specific serine residue, SIR530. This acetylation irreversibly inactivates the enzyme, preventing the production of prostaglandins and reducing pain and inflammation. Thank you.